It's being called the silver tsunami. 10,000 people turning 65 every day until the year 2020. Learn more about mental health issues facing older adults next on this Halloween edition of Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. What triggers depression or anxiety in a teenager or young adult is different from what triggers those very same problems in a person in their 70s. And as we age, we're more vulnerable to developing certain types of mental health problems like, of course, dementia. Tonight, we're talking about geriatric mental health issues. So start calling in your questions right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And of course, you can also email them using the address listed at the bottom of your screen. Now let's meet our guests. Dr. David Baldus is a psychiatrist with St. Luke's Mental Health Service who sees adult clients. And Dr. Deborah Viner is a licensed psychologist also with St. Luke's Mental Health Service who for the past 10 years has worked with seniors seeking mental health care. Thanks to both of you for coming out on this very happy Halloween. They have a lot of kids who come here and go trick-or-treating in the dorms, which was a little surprising. So if you're anywhere near the University District, drive slow. Although if you're watching TV, you shouldn't be driving at the same time, should you? So anyway, a little loose here tonight. I think a good place for us to start, Deborah, would be for us to discuss a little bit about what are the major mental health issues that seniors face.
Well, primarily I see people who have bereavement issues, loss issues, depression, and lots of anxiety just because they're going through so many life changes. So those are the biggest. There are a lot of medical problems that are scary, and but the loss issues are probably the most significant.
And so we have, it seems like then the top three would be the depression, anxiety, and then dementia, of course. And with depression, if we start with depression, Dr. Baldus, how do we expect depression to look a little differently in seniors than it would in a teenager?
Sure. Well, in the elderly population, in seniors, the depressive symptoms can in fact look more like dementia. So sometimes you'll see a person who seems to have a memory problem or has low energy or just is not interested in doing what they used to be and might not report sadness to speak of, and that may in fact be a depressive illness that's responsive to treatment for depression as opposed to a dementing illness.
And the other thing I think that we want to think about is the difference just between, so you say that you see a lot of people with bereavement issues and loss issues, and how, you know, I know that there are people out there who think that, well, bereavement and aging kind of go hand in hand because there are a lot of, you know, you may be experiencing a lot of people around you who are dying, and why would that need mental health treatment in a senior adult?
Well, I think they're going through so many physical changes, but quite often they're going through such significant loss because they may have to be moving into assisted living. They may lose a spouse. Children may be taking care of them, and loss of function, loss of what they worked all their life for. These are such significant life issues that they often become quite depressed.
So some of the other losses I think that we see certainly would be loss in physical functioning for some people, right? And talk a little bit then about that interrelationship between, we'll start first with the side of a person's who may be struggling with some physical health problems and the effect that has on, say, a senior's mental health functioning.
Sure. Well, certainly I've seen with men, particularly men who've had blue-collar type of jobs or physical labor type of jobs, when they lose that capacity for physical work, the sense of purpose and the sense of value or utility to the family in their mind can go away, and they can wonder, well, what am I good for anymore? That's certainly quite common. Another big one is the loss of the ability to drive, because driving is it's a quintessentially American thing to do, and when you can't drive, that really represents a major change in lifestyle.
And really, I think the quintessentially American aspect of that is the independence that driving gives us, right?
Yes.
You know, so that it gives us a sense of independence, but it gives us a way to be connected to other people in our life. And so I know in preparing for the show, one of the major factors that we know sort of helps people in older life is staying well connected to people, and that represents then a potential another loss, right? Is the degree to which you can stay connected, either because of other problems that you're experiencing, other physical problems. Talk a little bit about what you see in your practice with that.
Oh, that's a very big deal for people. They often can't hear well, or can't see well, or can't, walk real well. So getting around is difficult.
Mobility problems.
Yep. And of course, if they can't drive, that's a problem. They have to rely on others. And people will talk less to those who have hearing problems. They're not asked questions as often. Their children or friends may make decisions for them.
I want to talk, let's talk a little bit about that notion that we talk less to people who don't hear well because we're lazy, because that winds up being more work for us.
I'm not sure it's that. I'm sure it's people aren't sure how to speak so that people will not feel offended if they're speaking too loudly or misinterpret what people say. I check with people frequently. Am I talking at a good enough, can you hear me well? Am I talking too loud? They don't want to be treated differently, but in ways they need that special kind of help, which again is part of what you were talking about, that loss of function. It becomes so evident that it's hard for people. They won't speak up. They won't ask for things. They don't like to be dependent on others. So these are some of the things we talk about in therapy, and try to help people with reducing symptoms by connecting with others, writing more. If this new age of texting and emails is actually kind of helpful, except many people don't use that in the older ages. So
for some of our population, we're seeing for those people who have decided to go ahead and learn how to use a computer, that provides them with an avenue of staying connected with maybe either with other people whom they can't see real easily because of maybe some mobility problems, or maybe they've just other people have moved away, but also as a way of staying connected easier with maybe a younger generation.
Yeah, well, I have to say, my grandmother, and I love you, Gigi, really does appreciate an emailed picture of the grandson. So, and it is a way to stay connected with younger folks.
Talk a little bit about now the opposite. So we talked about the effect of physical health on mental health. Let's talk a little bit about when a senior is having some mental health problems, and then the effect of that on their physical functioning.
Sure. Well, certainly we see a connection between mental illness and physical function. Certainly depression in late life is associated with poorer general health outcomes. If a person is depressed after they have a heart attack, they're less likely to survive that heart attack. So there's a major influence. Also, people who are depressed tend to not do as good of a job of taking care of themselves. So say they have diabetes, they might not pay as close of attention to their diet, check their blood sugar appropriately, take their the insulin as they might be directed to. So overall, it's associated with poorer health outcomes.
And what do you see with that in your own practice then?
Well, it is exactly what I see. People are struggling if they're struggling to get around, then it means that it's difficult to get dressed, it's difficult to shower or take care of oneself. And many people, they do the best they can, but they really can't keep themselves up the way they used to. So it's difficult.
And so it seems to me too, just sort of building on what you just said, that one of the things that we can do, even that family members can do, is just asking the senior citizens who they love and care about in their life, how are you living on a daily basis? Right? That idea of, are you eating? What are you eating? Are you taking your medication? Of helping them if they're local, and they can help check in with some of these things.
That's a yes and a no, because one of the things seniors have a hard time with is being taken care of. And so there's a way to do that works, and there's a way to do that doesn't work well. And for each individual it's different. And it really is a matter of those who love people who are struggling with depression. They do have to check in, and it's necessary, but it is hard. It's actually probably hard for everybody that has a mental health issue.
Dr. Baldus, Charles from Duluth asks, what might be the cause of depression developing out of thin air for no other reason other than getting old?
Other than getting old. Well, I tell you what, depression can certainly develop spontaneously. We'd call that an endogenous depression, and
that doesn't seem to be connected to external
to external
stressors.
sources, right? It just seems to happen. Now, I would have to say, and I would trust my psychological colleagues, that perhaps we might be able to find something that is troubling a person, but certainly depression can arise spontaneously, and without an appreciable major life change.
And some of the research that I was doing just earlier this week suggests that people who have been mentally healthy for much of their life, that in and of itself does not guard against or prevent, it's not going to be, okay, you make it to 65, you're fine. You're never going to have depression.
Right.
And some of that seems to me to be also maybe based on some of these other factors, that the tremendous changes that people can be facing in older life.
Right, both physical and socioeconomically. People have come to a point in their life where there's not a lot of earning power anymore, or they're on a fixed income. And sometimes things like medical issues show up. Thyroid issues are common problems. They shift around, and people don't feel well, so not feeling well, that's really difficult.
Well, and you bring up a really great point, that this gentleman who calls in and asks about depression that comes out of thin air. One of the things that we know is that depression can also, things can look like depression that are actual physical illness, and this person could have a thyroid problem.
Right, thyroid problems, vitamin deficiencies, other kind of nutritional deficiencies, anemia is very common, so not enough red blood cells. All those things can make a person feel sluggish, and feeling tired all the time can feel awful close to feeling depressed.
Let's talk about the role of medication in the treatment of depression or other mental illnesses in senior citizens, and particularly in relation to kind of like what happens in general with medication and its effect on the senior body.
Sure. Well, we have to be very careful with medications in the senior population. Many times seniors are on a lot of medications. On average, people are surviving a lot longer and accruing more physical illnesses, and so it's not uncommon if I'm meeting with a person who's over the age of 70, they might have 15 medicines they take on a daily basis. And
which is a lot.
That's a lot. 15 is a lot, yeah. So we have to be very careful about interactions with other medications. And then also we need to be mindful of the potential effects that other medications have on the psyche, and be very careful with medicines in the senior population that might have some possibility to cloud their thinking.
Or I also think of some of the antihypertensives or beta blockers that can really slow people down and make them feel sluggish. And that can also then, with that poor energy, and you don't feel good and start just feeling depressed a little bit because of that as well. Some of the changes that happen in the body just with the the slower metabolism, so medicines stay in the body longer.
Exactly.
And what are the implications then? You see a physician and they're prescribing the same dose of the same medicine that they would to the 23-year-old with depression to the 76-year-old with depression.
So there's a risk of the medicine building up in the body, of having increased side effects, possible, of course, toxicity with some of the medications that we prescribe. Certainly risk of changing in thinking or periods of confusion with some of the sleeping medications if they build up in the body. So it's a sort of a risky proposition, and best done carefully.
And we also know that therapy can be helpful for people with mental health problems well into their senior years.
Yes, I enjoy very much working with seniors. They really do want to talk about these things. And it's not something they generally talk about because they don't want to complain. And so they have an opportunity to really open up about what it feels like to go through what they're going through in a private place. And I see people come from nursing homes and are more, they're being encouraged to come, which is really great. I think that's been for a while an unrecognized population of people who really need to get out and be seen and be able to talk about what it's like to have to be, again, taken care of, monitored, and not have freedom.
And to be heard, right?
They want to be heard. They want to tell their story. They have a lot to say, and they have a wealth of information about their life. And they're so interesting. The people that I see are so interesting and have a lot of experiences that they want to remember.
Here's a question that has come in from a woman in Duluth. Dr. Baldus, are there certain medical issues that can lead to memory loss besides Alzheimer's?
Certainly. So aside from Alzheimer's disorder or a disease, depression of itself can cause memory problems. Again, vitamin deficiencies, B12 deficiency, folic acid deficiency, again, low thyroid. Also, there are other causes of memory loss that are not Alzheimer's disease, but that are other dementing illnesses. So certainly, people can have problems with memory or thinking after having had a stroke, depending on where it is in the brain. So there are a variety of mimics of Alzheimer's disease.
And in fact, that multi-infarct dementia, as we know it, is the second largest form of dementia, with Alzheimer's disease being the largest. And I think it's at least the name that we're most familiar. What are the issues that you see with people with dementias? Are you seeing, Deborah, in your practice, the person with dementia coming in, or are you seeing the family members of the person with dementia coming in?
Definitely both. Sometimes people will come in and have dementia to the extent that you're really hearing the same thing said many times. And that's okay. And family members can really be helpful. And also, family members need the attention as well. They often will come in and ask if they're doing the right things. They often feel overwhelmed and they may be getting burnt out. I see people who are caring for elderly people and work on helping them not to feel that they are doing something wrong with their loved one because they get guilty. So yes, I see families and I see the individual themselves. Mostly for direction. The family member wants sort of some validation that they're actually doing the right thing. And family members really want to tell people their family members how difficult it is to be told what to do.
In Alzheimer's or any of the other dementias, let's talk a little bit about what the medical treatments are that are available and how effective they are at this point in time with what we know with the research.
Sure. So treatment of dementing illness has been difficult and limited. We do have a couple medications in a class that we call cognitive enhancers that seem to slow the progression of Alzheimer's disease and can give people more time in their homes and delay the time before, or extend the time before they need to go into a kind of a skilled care setting. Now, in addition to the memory loss problem, there can be problems with behavior changes, or personality change, or agitation. And so we have other medications that we use to try to help manage those problems, although those folks tend to be in a later stage of the illness.
And so it's important to note that the medications that we have with this point in the science are not disease modifiers. They don't cure the disease. They're symptom modifiers.
Correct.
But that having been said, the earlier you seek attention and help, that these medications tend to, if I'm reading the science correctly, you can correct me if I'm wrong, that the earlier in the sort of newly onset to maybe a little bit more moderately advanced is where we seem to see the most effectiveness with this.
That is right. Early intervention is the name of the game here.
And so what would you say then, Deborah, are some of the keys for getting people in earlier who may be in this early form of memory loss that's not normal, that's beyond normal memory loss that we see in normal aging? What do you think are some of the keys of breaking down those barriers and getting people in to get them some help?
Well, you know, I talk to family members frequently in my regular practice, you know, the people I see on a regular basis. And there's plenty of them that are dealing with this in their loved ones, parents. And I talk to people often about what are the resources out there, getting their family member into therapy, helping them I assist in helping them get a family member into a therapy session, you know, getting involved in therapy, or hooked up with perhaps the Alzheimer's Association or support groups. But the family members are essential in the care of seniors.
And it seems to me, Dr. Baldus, that one of the other primary ways that you could help in getting a family member some assistance is through their primary care doctor as well. They may be more willing to go, and they may have more appointments with their primary care doctor.
Certainly.
That could be as sort of as a gatekeeper in.
Right, and I think the tricky part about the early stage of something like Alzheimer's disorder is that it can, you know, people will mistake it for sort of regular aging. They'll say, well, I think that's just kind of normal. They might be slipping a little bit, and we don't want our loved one to have that kind of a problem, and so we can tend to ignore it. And then, of course, diagnostically, it's a little tricky in that early stage of the game, and is best detected by really formal kind of neuropsychological testing.
And so that complicates it too, right? That it's not easy to diagnose. So it's easy to want to minimize and not easy to diagnose, and those factors are pretty big barriers for people getting in. Though if you may have a problem, you're better off asking the question, because you either have it or you don't, and if you have it, you can at least start getting help for it. This is sort of changing back a little bit to the depression, but it's such an important question, Deborah. Bill from Knife River calls in to say, do thoughts of taking your own life come with age? Meaning, do people who are in their senior life have thoughts of suicide sometimes?
Yes, I see people that do. Depression can impact people of all ages so severely that it people will get suicidal. And so, of course, the same types of interventions that are put in place for any other age group are put in place for the seniors that I see. You know, we do safety contracting. These are people who are needing to tell people that they feel this way, loved ones. Sometimes I'll have family members come in and talk with them about this and how they can manage it. Maybe see the person more frequently.
And so that more people are aware also, right?
Yes.
That one of the things that we know that helps people to stay alive is more people understanding kind of what the person is going through and getting that support.
Yeah.
Getting that support that they need in the family. If there was something that you wanted to say to our viewing audience then about what people can do to keep themselves mentally healthy in their senior life, what would that be?
Well, I would say number one across the whole age spectrum is healthy body, healthy mind. That taking care of your body, making sure you have appropriate nutrition, a regular exercise, use your mind, stay engaged. These are the things that are going to help prolong mental health as long as possible.
Well, we're coming down to the end of this show, and so I think we need to start wrapping up because this time goes by so quickly. So what did we learn? Well, what you just heard from Dr. Baldus is it's that same thing still keeps being true. Eat the right things, exercise. We're still supposed to be exercising. Get involved and stay involved with people. That might mean volunteer. Do something new. Do things that you enjoy. If you're having difficulty out there and struggling and you're a senior, one of the things certainly that you heard Dr. Viner talk about is that help is available, that help matters, and that doesn't matter how old you are. So it turns out that mom, dad, old dogs can learn new tricks. I think they're going to kill me for that one, don't you? Thanks so much for joining us tonight, and don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links and read my blog, the place where I answer more of your questions. And you can also email us your questions about next week's show, when we'll be talking about raising children without raising the roof, which means I guess that's possible. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.